body is looked at holistically in its totality. And one layer deeper, the body is looked at as 100% extension of existence. So the body is not looked at as a part of the self, as a part of you. So simply, if there is a problem with the body is treated. That is all. Actually, if you think about it, Ayurveda never mixes the mind and the body. Because although we keep telling whatever you're thinking, your thoughts, everything manifests, it becomes the body. For Ayurveda, that is totally irrelevant, because an Ayurvedic doctor or a person who's treating you cannot go and change your thoughts. So he starts from where the body is already there. It is already manifested. And that works brilliantly, because then he can just establish the relationship with the body and the environment or environment and deal with it. See, the problem with the modern understanding of the body is the body is divided into parts, and more parts, and more parts, and more parts. And every generation we are dividing it into more parts. And for every part we are creating a specialist. You know, there was a time a doctor was a doctor. Now, the moment someone says he's a doctor, he's like, what doctor are you? You know, this would have been a completely idiotic question a generation ago. If he says he's a doctor, then he knows how to treat the body, he knows everything. But now you have to ask, what kind of a doctor are you? Do you deal with my teeth or my heart? He says, I'm a heart. Okay. A generation will come when that will not be enough. Then you'll say, oh, heart doctor. What kind of a heart doctor are you? What do you do? You know, someone does open heart surgery, someone does closed heart surgery, someone is taking care of the left ventricle, right ventricle, and you will say, I am a left ventricular specialist. This is all going deeper and deeper, dividing the body into parts. Now, your body doesn't function like this. Everything is interconnected. It's one connective whole. So if you start dealing with the body in parts, in bits and pieces, you will never be able to cure it completely. That is why modern medicine does not restore health. It only treats the symptoms. That is why modern medicine can never be used as a replacement for a healthy way of living, eating healthy food, good food. Doctor comes into the picture only when something goes wrong. In Ayurveda, doctor doesn't come into the picture when something goes wrong. Usually, you have an understanding of the body, and when you meet, now Ayurvedic doctors, most of them are still, hybrids now. Half of their mind is oriented towards Western science because they want to cater to that audience. So if they don't give tablets, people don't come. So they have created their own tablets. The same neem that they used to give, now they have created tablets out of it. Every tablet, everything comes from existence at the end of the day. Nothing is artificially manufactured. So when Ayurveda says existence is the healer, even Western science understands that. But it doesn't want to say it because it cannot market it. It cannot sell its products. So it has to create something out of it, create a complicated name and make it completely artificial so that you can pay hundreds and thousands of dollars for those same tablets that you can go and pick it up from nature and existence. It is there. Everything is out there in existence. And that is what Ayurveda is. But if you were to meet someone who has a real good understanding of the science of Ayurveda and who has spent enough time, for him, making sure that the body stays in optimal health is what he's paid for, not for treating the symptoms. And the more you have the necessity to go to him, the less efficient he is. It is a totally reverse process. In fact, this same thing extends even to Japan. In Japan, they say you pay to the doctor when you don't go to the doctor. If you go to the doctor, you don't pay him. Because if you go to the doctor, then he's not done something right. He's not done his job, so you don't pay him. But if you don't have the necessity to go to the doctor, you have a family physician or somebody, and he's given you certain instructions, certain foods to eat, certain things to do, and if you have no necessity to go to him again and again, that is when you need to pay him. Which is a little extreme. Businesses won't work that way. Businesses will go bankrupt. All hospitals will shut down if you say, that, because it's a complete inflation. Medical profession is a total inflation of, certain ideas. It's the same inflation of desires, but it's gone to a totally different level now. See, body is, since it is an extension of nature, the balance can be restored by just adding something and removing something. So that is where in Ayurveda, the first thing that they'll see is the body's temperature, the way the body is functioning. I'll give you one simple example. My grandmother, she has BP, she has sugar, which are all Western terminologies, by the way, right? So she takes one whole bunch of tablets, and then she realized that she had like burning sensation in the stomach, and she was feeling very weak. She was becoming thin. She did not have energy, to sometimes even get up from bed, and she was becoming weak. So people suggested a lot of things. She started taking more and more tablets, and she started becoming more and more weak. And someone suggested, I think I myself suggested, why don't you go to an Ayurvedic doctor? Just give it a try. Just see what is it. We went to this clinic. This young doctor, he didn't look like somebody who has all the knowledge of Ayurveda and this and that. He was just like a boy. But then 5 minutes he spoke. I have visited doctors, I've taken my mom to a doctor, my grandmother, I myself, my sisters. All my life I've been visiting the Western, clinics and hospitals and nursing homes. This was the first time I had visited an Ayurvedic clinic. It's a very small clinic, nothing sophisticated. One look at that place, you would think, I don't want to go here to get myself treated if the place is like this. Because you're used to nice, clean, sophisticated, nursing homes and hospitals, and, doctors with those uniforms and very professional looking and, all that. Now here he was a simple guy. He was wearing his normal clothes and he was just sitting there. But 5 minutes he spoke, and I knew in that 5 minutes that this is what people need. This is what the whole world needs. And people are running behind something else. This is what he said. First thing he said is, see, first he asked, the questioning itself, surprised me. The first thing he asked was, okay, what is it that you're facing? What problems? So she started telling, gastritis, and, I'm having, my stomach hurts, but I don't have energy. It's like, I eat food, but then somehow I don't feel energetic. Even after eating food, I just feel very tired. So he asked, for how long have you been experiencing this? She said, for 15 days, or a little more than that. Then he said, okay. Then he asked, what tablets are you taking? Because he knows where the problem is. So she gave the list of tablets. These are all the tablets that I'm taking. All that. Then he said, okay, for a few days, you reduce all these tablets by half. If you're taking 2, take 1. If you're taking 1, reduce it to half. Just reduce the quantity by half, right? And then just take these neem tablets. He gave her neem tablets, just pure neem. Right? So he said, see, the problem is it has nothing to do with, tablets are interfering, but then your digestive tract is not able to absorb all the food and energy because of all these tablets. These tablets have created such an atmosphere where your intestine has become weak in absorbing all the food items because of all these chemicals and everything. Just take this neem for a few days. And then he looked at her mouth, he looked at her eyes, he looked at the fingernails, and then he started writing few things. It's just like balance. He has like a chart, what is to the left, what is to the right. Nothing sophisticated, no x-ray, no colonoscopy, this scopy, that scopy, nothing. He's diagnosing all this just by holding her hands, touching the fingers and looking at the color of the fingernails. Because when you look at the color of the fingernails, you can tell whether you have excess heat or excess cold, because the nail color changes. If it is excess heat, it turns yellowish. You've not observed it. If you look at this part of your finger, it changes color. It's not always the same. Sometimes it's yellowish, sometimes it's white. This part, the nail, the tip of the nail, the root of the nail, right? He observed the body, as if he was not at all asking about the specific problem. He was asking questions that are totally different. Like he was asking her about the food, the kind of food she eats. What kind of food habit she has. And then he suggested her certain foods. He said, okay, just you eat these foods. I had never heard these suggestions at all from a medical doctor. The first thing that they say is, you go to the doctor, he sends you to another room. That is all I know. You go to the doctor and you say, your stomach is hurting, 5 minutes he talks to you and says, okay, you get this thing done, you get this x-ray done, you get that done, you get this done. That is how it is always done, because you have to go deeper. Here, the deeper is not deeper, is a deeper understanding of your life, your lifestyle. She came back home. She said, I don't know if this works. He's just giving some neem tablets. How will all these simple things work? 1 week, completely she changed. I'm not joking. Completely she changed. She reduced the tablets. She started taking those neem tablets. That started cleansing the system. And the neem stimulated the intestines. And she started craving for food. And the food was getting digested properly. Everything started falling into place. Just a simple understanding that, oh, this is all what you need. This is a simple problem. There are problems that Ayurveda has cured. Modern medicine is still trying to understand how is that even possible. In India, we call cancer puttunoi. That is what the Tamil word for cancer is. And for Ayurvedic doctors, puttunoi is like fever. They don't stigmatize cancer. For them, it is not at all a big deal. For them, it is just a clumping of cells because of certain energy blockage, energy flow, and they treat the entire body. Unlike here, if you say, I have cancer here, they'll burn it using laser, only there. But ask them, okay, how do I make sure that these cancerous cells don't keep coming back? Because there is a reason why it's coming back. There is a problem. If you ask them, they would not know the answer for that because they've never studied the body like that. They've only been treating one part and one symptom at a time. If there is something wrong, burn it, remove those cells. It's almost like everything is treated like, oh, that part is infected, let's treat it. In Ayurveda, cancer itself is treated very differently. The approach itself is different. Cancer patients are taken into what is called an intense program where they're not sent home. So for almost, close to a month, they are put into this regime. Changes in food, changes in everything, what they eat, how they eat. They have a set of things that restores the balance to the body. And for 1 month, they are in a lot of things like mud bath, oil bath. It's basically energy, lots of massages, because the body somewhere has got into a different pattern. an uncomfortable pattern. So they break all these patterns so that the body can go back to its normal, usual functioning. And if you do all that, a lot of physical intervention in that sense, from outside, not from inside. See, getting inside the body should be the last resort. But in modern medicine, that is the first thing that they do. You come with a problem, they want to go inside. You should not do that at all. Ayurveda never does that. Every treatment should be external, because even existence, when it wants to heal, it heals you from outside. It heals you from your natural sensory perception, because Ayurveda believes that healing is as much about you knowing and believing that you are healing as it is a physical process. This aspect of psychological healing, being with the healing process, is not there in the medical profession. Everything is treated like physical. The person is not necessary at all. Here, everything is deliberate. It is slow. The patient is told about the healing process, and he's told, oh, this is how it heals. So psychologically also, your body is preparing itself to heal, and everything is given time. Nothing is healed quickly. That is why some people don't like Ayurveda or few other medicines. There are homeopathy. There's another completely different stream called homeopathy, which takes time. You start taking these tablets, start taking these medicines that are restorative, that are not treating a symptom, that is restoring the overall body's energy, and that is why it is taking time to heal. If you want quick relief from pain, quick instant things, then you go to the Western medicine. If you really want a long-term understanding of your mind and body, you rely on Ayurveda. Again, how does existence heal? Just by restoring the balance, that's all. Energy balance.